So good morning and welcome, everyone. Hope you enjoyed that banter while we were waiting to get started. This is Jim Rooney. I'm the president and CEO of the Greater Boston Chamber, and on behalf of all of us at the Chamber, we hope you're joining this call feeling safe and healthy today. As we continue to adapt to this unprecedented time at the Chamber, we're committed to serving as the voice of the business community in the region, but also being a conduit to keeping us connected and informed, not just among the business community, but with elected officials who are actively dealing with this crisis, whether it's at the city, the state, or the federal level. And in that spirit, amidst this COVID-19 crisis, we're here today to hear from Congressman Stephen Lynch, who was very busy right now, especially last week, working with his colleagues in Congress on the much publicized relief bill. Also joining the call is Robert Nelson. Robert is the Massachusetts District Director for the U.S. Small Business Administration. And if we get into some questions that might relate to some of the specifics of how the SBA is handling these loans, I'm sure Bob will be able to help us answer those questions. A couple of housekeeping notes. This webinar is being recorded and will be shared on our website, bostonchamber.com. For those of you that are joining us online, you can ask questions live during the webinar. You submit them through the Q&A feature. Make sure to send the questions to all panelists. And for those who have dialed in, if you want to email in a question, you can email them in to policy@bostonchamber.com. With that, I'm pleased to introduce our special guest this morning, Congressman Stephen F. Lynch, who was first sworn into the United States Congress in October of 2001. Stephen was born and raised in South Boston, went on to a career as an iron worker, became the youngest president in the history of the Iron Workers Union. In the 116th Congress, Congressman Lynch is a member of the Financial Services Committee, the Transportation and Infrastructure Committee, and the Committee on Oversight and Reform. He is a co-founder of the Congressional Labor and Working Families Caucus, which was formed to protect workers' rights and educate members of Congress on issues that impact American families. Stephen, thank you so much for joining us today to give us an update from the nation's capital. Congressman Lynch, the phone is yours.
Thank you, Jim. Good to hear your voice and good to be with your members as well. Thanks for your invitation. I was thinking in anticipating this phone call that I might just give a little bit of a summary of where we are health-wise in terms of confronting the coronavirus and the governmental response and the healthcare community response to what we get going on in the greater Boston area. And then we'll get into the business aspects of the relief bill, the CARES Act, and then maybe we can bring in Bob Nelson on some of the SBA aspects of this, because they will be a key administrator and facilitator of the loans and grants that we've approved in Congress, which was the third stimulus bill that we put forward. I've had a chance over the last week to 10 days to get out to all of my major healthcare facilities. Spent a little time over at the county hospital in Dorchester has been identified as a coronavirus focus center, and they are set up with that. They've got a tent for drive-up testing, so they're slowly developing the capacity to do that in a larger way. They don't have a whole lot of extra bed space there, but they're looking at possible expansion as well within the facility. got a chance to meet with the heads of most of our major hospitals, at least in my district, as well as the health center CEOs, the community health center CEOs, and also had a chance to visit the Brockton VA. As you may know, I've got 3 major VA facilities, VA hospitals in my district, one in Brockton. I've got one in Jamaica Plain and one in West Roxbury, which is an acute care facility. In addition to that, I've got some VA clinics, they're sort of outpatient clinics that operate in Quincy and in Brockton. There's one up in Lowell, not in my district, obviously, but and then one down in Hull. So the task here on the healthcare side is really to identify those people who are exhibiting symptoms of coronavirus, and then to track them, isolate them, treat them, and so there's a set of needs out there. Number one, you have to have the equipment necessary for the healthcare personnel to actually conduct the tests. You have to have a place to test them, test the general public. You have to have sufficient bed space to treat those that need hospitalization. And so we have challenges on all those fronts. Number one, we did not have sufficient PPE, personal protective equipment, for our healthcare workers. That is still a problem. I've taken a rather recent survey of our healthcare facilities, our first responders, and everyone is still working on 2 to 3 days worth of PPE. Many of the hospitals and healthcare facilities are using extended life protocols to reuse, recycle, and extend the life of some of these N95 masks. Far less than ideal situation, so they continue to do that. The availability of tests is still very limited, so we've been in conversations with some of the foreign suppliers, and that's being handled at the state level, the Department of Public Health, back and forth with Mary Lou Sutters, the governor's secretary on health. So where that situation is improving, but not as quickly as we might like. So there are little limited testing opportunities out there, and as long as we are not at full spectrum testing, and by that I mean what the president described on March 5th. He said anybody who wants a test can get it. That's not the situation now, nor do I expect it to be the case within the next 2 weeks. I think maybe 3 weeks out we might have sufficient tests, but that's just speculation. All I can tell you is right now that we do not have the tests to do that. We do not have the masks, the gloves, the gowns, the face shields to conduct the test for our healthcare workers to do it consistently and with the appropriate level of protection, and not at all in the volumes that we expect. So until we get that full spectrum testing, most health centers, most hospitals are asking people who present with symptoms to self-quarantine at home. We're sending them back home unless they're so sick that we test them and then we admit them. And even now we're reaching capacity at most of our hospitals, if not all. Bear in mind the way healthcare works in our region. in normal circumstances is that most of these hospitals run their operations at a 95% or a 92% occupancy rate. So there's not a lot of float in there. Basically, you know, the 8% vacancy is really people leaving and people coming in. You know, that's the crossover there. So we don't have a lot of excess capacity. We can develop that. And I know that I've had discussions with General Keefe, the commanding general for our National Guard. The Army Corps of Engineers is reviewing potential space that I know they reviewed the Heinz Auditorium and the BCEC, the Boston Convention and Exhibition Center in South Boston. They've looked at both of those sites as well as others. We also have some unused space that's not online, but it is available in Brockton at the VA. It could be accessed, some space at the West Roxbury VA, and up in Bedford we've got a significant amount of unused space, but it would take significant resources to bring that stuff online. Not that we're beyond doing that, but we are trying to make sure that the added bed space is created in areas where we can staff it. In other words, we don't want to create a remote space for treating patients and then have to, you know, bring in staff to, you know, going to need nurses, you're going to need docs, you're going to need healthcare workers. So to fill up those, you know, to treat the people that we bring in is a whole other set of needs. So we're trying to use existing staff, and where we can bring in extra nurses and docs and healthcare professionals who may have been in retirement. I know that the mayor and the governor, we've had conversations. I believe the governor and the mayor have advocated allowing some of our nursing students who are fourth year and about to take their boards to graduate early, and that would obviously increase the supply of nursing staff by several hundreds who are about to graduate anyway, and they would obviously get credit for this as far as clinicals go, and they could take their boards later on. So again, until we get a good grasp of what the numbers are, let me put it this way. Once we do have the tests and are able to do, and we do have the PPE to conduct full spectrum testing on everyone who presents with symptoms, until we get that, we have a large unknown, and we have a growing, because if those people are being asked to self-quarantine at home, they're likely infecting their housemates or family members. They may also be infecting some of the public if they do not observe very strict distancing methods. So we don't have, until we get that, we don't have a good grasp on this. And so when we do get the tests and do get the equipment, the numbers will spike. And I think that we are still 2 to 3 weeks away, as I said, from building that capacity to be able to judge the numbers. So that's where we are healthcare end. As you know, on Friday, we flew down and took a vote on the CARES Act. This is the third stimulus bill that we've done. We did have calls from various segments of our Greater Boston Chamber of Commerce community with respects to different aspects of what was going on. We were able to, with the help of Richie Neal, the Chair of Ways and Means, we worked very closely with him on the requests that were coming from the Greater Boston Chamber of Commerce. We were able to address a number of those requests. We had a request from the distillers that had converted their operations to producing hand sanitizer using the alcohol from their production facilities to convert to hand sanitizer. We do appreciate that. There was a real need out there, and yet there was an excise tax existing that would have penalized them for doing that. And with the help of Mr. Neal, we were able to eliminate that provider provision in the recent coronavirus relief act that eliminated that excise tax for the year 2020, I believe, the calendar year 2020. So that was a guy. Not everybody in my district was happy about that, by the way. You know, I heard from one of my constituents in Dorchester who said that it was a terrible use of alcohol, and that they were very upset that it was being used for that. They're still complaining about the fact that we canceled the St. Patrick's Day parade. So I'll have to answer for that on Election Day, I guess. But I still think we're doing the right thing, and I think that we're all very grateful that the distillers were willing to convert their facilities over. Their workers, dove in and really helped us with that. And we're very, very grateful. We've seen a lot of that. A lot of businesses stepping up and offering space. You know, we've heard from landlords that have had buildings that were about to open, and they've offered those apartments to nurses in the South Boston community, especially who didn't want to go home and were fearful of infecting their families. So they've offered apartments to some of the nursing staff to say that they could use their buildings and instead of going home, and they're pretty close to the hospitals as well. So a nice gesture as well. There's a lot of money that's available, and I know my friend Bob Nelson from the SBA is on the line, the Small Business Administration, and he's going to be presented with a very difficult task. I need to be fair to him. So just to give you an idea of what we're doing here, the SBA book of business, let's say, the volume of loans that they provide guarantees on and do assessments of, in 2018 was somewhere in the area of 23 billion, maybe 24 billion, right? That's their book of business under normal circumstances and what they're staffed to accomplish. And they do a good job at that. They're now being asked to take on a book of business that's 340 billion, okay? So you realize the increase of demand and the gargantuan task that is being placed on Bob's shoulders in our region and his cohorts across the country. So I think it's fair to say we're asking an awful lot of the SBA to be the point agency on this stuff. So I think a fair amount of patience and understanding and assistance is probably appropriate as we go forward. Just to give you the numbers, under the CARES Act, we provide $150 billion to state and local government. A lot of that is going directly to the mayors. We felt that they probably have a firmer grasp on that. I think it's 60-40. I think 60 goes to the municipalities and counties, and 40% goes to the governors of that 150 billion stabilization fund. So just to give you an estimate, I believe that the Massachusetts will receive about 2.7 billion, which is a big number, but there's a lot of need out there. We also included $260 billion in expanded unemployment benefits, and this includes numerous provisions to improve unemployment benefits. We provide an extra $600 on top of the usual level. This is an attempt to reach 100% wage replacement. The feds have also agreed to extend the federal assistance, which adds another 13 weeks. Usually you get 26 weeks from the state. We provide another 13 weeks, and we pick up all of that, all of the expanded costs rather than a sharing proportion. So that gives a total of 39 weeks to some of these workers. And the $600 a week is capped, though. I think that is until September. I'm pretty sure that's until September. It doesn't say that on my sheet here, but I'm pretty sure I read the bill through, and I believe that they extend the extra $600 until September. However, that we have plenty of time to revisit that as well. There's also direct cash payments to lower and middle income Americans. Provides $1,200 for each adult and $500 for each child. So that's $2,400 for a married couple filing jointly. And it actually provides benefits up to a person making $99,000 a year. But after $75,000, there's for every $100 you're over $75,000, there's a $5 decrease in the benefit. So we could figure it out. So up until $99,000, and then it's a clear cutoff. No one above $99,000 will receive any portion of that direct cash payment. That's a one-time payment, by the way. So there's more than $375 billion in small business relief. It provides more than $375 billion, including about $350 billion for payroll protection, which is offered to businesses that keep people on the payroll. There's also $17 billion for debt relief for current and new SBA borrowers, and I'd rather let Bob Nelson describe some of that. This might be a good time for you to jump in, Bob, and just describe what the SBA is offering.
Sure. Thank you, Congressman, and thank you, Jim, for having me as part of this morning's call. So the first thing that I figured I would talk about is the economic injury loan program. So Massachusetts got a full statewide declaration on the 18th of March. Since the time Massachusetts got its declaration, all 50 states across the country have declarations. So there are folks from all over the country applying for these economic injury loans through the SBA. So the application for the economic injury loan is through sba.gov/disaster. If you go onto that site this morning, you'll find that it is an entirely new process. Just talked to a small business owner who applied, was saying how easy it is and very complimentary on the new process. So I think we've come a long way from when we were initially doing these applications starting on the 18th. So the economic injury loans, they go up to $2 million for small businesses. The interest rate is fixed at 3.75% fixed for the life of the loan. The terms can be as long as 30 years. Private nonprofits are eligible. The interest rate for private nonprofits would be 2.75% fixed for the life of the loan. And again, that can be as long as 30 years. These economic injury loans, and we're encouraging all small businesses to apply and to apply sooner rather than later. It gets you in the queue. As you heard me mention, everyone from the whole country is applying for these, what we call EIDL loans, EIDL. The proceeds of the economic injury loan is to help the business and private nonprofit to make payments that it otherwise would have been able to had the disaster not occurred. So the proceeds could be used for accounts payable. It could be used for debt service payments, for employees, for payroll, for rent, all the different working capital needs of a small business can be used with that loan program. So what is important to remember is that the Economic Injury Disaster Loan Program, it's administered by the SBA. This is a federal government disaster loan program, and it is not processed through banks. Now, one of the provisions under the stimulus bill is that there's the ability to get an economic injury grant. And so what it says is that these grants provide an emergency advance of up to $10,000 to small businesses and private nonprofits. So I just want to stress that it says up to 10,000. I'm not sure, we're expecting to get guidance from SBA headquarters within 24 to 48 hours so that we can answer with the best and most accurate information that we have. But in order to get one of these economic injury grants, the small business or private nonprofit would apply for an economic injury disaster loan and then request the advance. What you need to know is that the advance does not need to be repaid under any circumstance. So this is a grant, and you can use those grant proceeds to help with your recovery. So this is free money. There's going to be a lot of interest in this. It's eligible for small businesses. 99% of the businesses in Massachusetts are small by our size standard. So again, we're encouraging folks to apply. Request the advance so that we can help to get you some immediate cash. I know that people are wondering if you get an economic injury disaster loan or an economic injury grant, can you also get one of these new what we call PPP loans? And that's a payroll protection program. So the payroll protection program is new as part of the stimulus bill, and this is where we're waiting for guidance from headquarters as far as how it's going to work. But what we know is that it is going to be a 100% federally guaranteed loan to employers who maintain their payroll during the emergency. The thrust of this program is trying to help small businesses to maintain their payroll so that when this passes, they're going to be able to quickly get back in the groove with their small business and get on with their recovery. So you can get a economic injury disaster loan. You can get a payroll protection loan. You can also get one of these economic injury grants. SBA, if it can't be the same use of proceeds with the different loan programs. And so what we're going to be needing to do over the next week and a couple weeks is to try to help small businesses to figure out what's best for them. How much money should they be looking for under the economic injury loan, under the payroll protection program. It sort of gives you the math as far as how you would be able to calculate the loan amount. And again, so under the payroll protection program, it is for small businesses, and private nonprofits are part of that. So think fewer than 500 employees, but if the industry classification code isn't employee driven, then we can look at the size standards based upon the revenue. SBA has relaxed the affiliation rules, which is going to make it easier, and that's for franchises and also for restaurants and hotels. As far as the loan amount under the payroll protection plan, it goes up to $10 million. If the business was in operations between February 15th, 2019 and June 30th, 2019, the max loan is equal to 250% of the average monthly payroll costs during that period. And if the business wasn't in business from 2/15/19 to June 30th, 19, the max loan amount is 250% of the average monthly payroll between January 1st, 2020 and February 29th, 2020. And so the proceeds, under the Payroll Protection Plan, it can be used for compensation, payment of vacations, allowance for dismissal or separation, payments required for provisions of group health care benefits, including insurance premiums, retirement benefits, and payment of state and local taxes associated with the compensation of the employees. And so what is interesting with this payroll protection plan, there is a forgivable amount. And so if you are able to maintain payrolls at a certain level, a portion or all of the loan will be forgiven. This is a 100% guaranteed loan by the SBA. It will be administered by our lending partners. And this is where we're really fortunate, Congressman Lynch. With our regular loan programs here in Massachusetts, we have 135 different lenders who use our program every year in Massachusetts. We have a really robust network of lenders. I think lenders will be very hot to help out with this loan program, especially since it's 100% guaranteed by the SBA. And one of the other real nice things about the Payroll Protection Plan is it doesn't require any personal guarantees on the part of the applicant. As far as the forgiveness on a covered loan, it's equal to the sum of the following payroll costs incurred during the covered 8-week period compared to the previous year or time period. It excludes compensation of over $100,000. So it's not intended to cover payroll costs for individuals and owners that have compensation of over $100,000. So I know people started emailing and calling my staff and myself on Friday. How do we get these loans? How do we apply? Folks, as you mentioned, Congressman, we need people to be just a little bit patient. We're expecting to get some guidance within 24 to 48 hours, and then it's going to be a full court press to make sure that everyone knows how the PPP loan program works, how it can be accessed. Having new lenders who are not part of our network approach me to become SBA lenders, which I think is going to be good for us with this, but even continuing as far as adding lenders to our network. But my team, I have an amazing SBA office. It's a small staff, and including me, it's 11 here in Massachusetts. And I can tell you, we've been working overtime on weekends, doing whatever we can to try to address all the questions coming at us. And so I think I'll stop for now, but there is one other loan program that I do want to mention that we've been encouraging our lenders to consider and letting small businesses know about it, and that's called an express bridge loan. It would be eligible for our express lenders to work with small businesses that are existing customers. The bank is able to give them up to $25,000 unsecured. They get a 50% guarantee from us, and the hope is that lenders will help to do these express bridge loans. It's not a lot of money, but I can tell you, some of these small businesses, $25,000 can make the world of difference with helping them with some of their debt obligations, so that they can start with their recovery and paying some of their obligations. And so that's something that I'm going to be pushing hard on our lenders to make these express bridge loans. And it's just another tool in the toolbox to try to help get badly needed capital into the hands of our small businesses as quickly as possible.
That's great. Thank you, Bob. And let me just offer my assistance. you're not going to be able to handle all this with 11 employees. That's obvious. So let me try to get you some help and try to get people as acclimated as possible to the programs that are out there.
So, Congressman, a big part of our work is outreach and educating the community. We have a disaster processing center down in Fort Worth, Texas. SBA, from what I hear, is looking to partner with private industry to help with this. And I'm going to wait until there's a formal announcement from the administrator on that. As far as help, here in Massachusetts, we have an amazing small business development center network. Our SCORE organization and our 6 chapters are probably some of the very best in the entire country in our women's center. So in addition to the Small Business Development Center staff, our SCORE organization, and our women's center, we've trained them all up on the economic injury disaster loan program. They're helping small businesses navigate the online system and helping them get their applications together. So now we have new things, and so we need to continue to educate our partners. But we have a strong partner network here in the Commonwealth, Congressman, and we're really very, very fortunate.
I'm sure you are. I just know the volume of work we're asking you to do, and the speed at which we need you to operate. Right, because we have businesses out there that are hanging on. Bills are coming due, and so the pace of getting assistance out there is extremely important to these businesses. So I think you'll hear that.
Yes.
Yeah, I think you'll hear that. The other thing is just in terms of the disaster loans, Congress provided $10 billion in that pot. In terms of the Paycheck Protection Program, where we're trying to get businesses to retain employees, we put $350 billion in that fund. So you can see the emphasis that Congress has put on the function of retaining employees and the forgiveness of loans that comes from that. So. And I know there are a lot of businesses out there that I've talked to who said, "Look, I'm refusing to lay people off, but I don't know how long I can do this." And so, we hear that and we appreciate that, and we want to make sure that you ride this out in a fashion that allows you to come back online as soon as we get through some of the worst of this. So we're all in this together, and we're trying to put the resources where we think they'll be most helpful. One last thing that I did want to finish up in terms of the allocation of resources. We also provided enormous help to hospitals, and there's $100 billion that goes directly. So on us, we already did an earlier supplemental for healthcare facilities and hospitals, but because of the surge in need and because of the dire situation of a lot of the hospitals in areas that are experiencing hot spots, we provided an extra $100 billion for hospitals to deal with the cost of coronavirus care, and we provided $1.3 billion for our community health centers, which was also desperately needed. The health centers provide health care to about 10% of the U.S. population. So in many of these rural areas as well as urban neighborhoods, they are the provider of choice. So, and this is not the last. Obviously, this is not the last bill. We're already anticipating a fourth supplemental, but we've got to wait and see how this tranche of money helps and where the need might remain. So that's where we're at on that. I don't want to just recite the numbers because they're out there and they're available, but perhaps one other piece, just Bob, if you would. I know that we offered the Payroll Protection program, which encourages businesses to retain employees and then in return forgives those loans. But also, some businesses couldn't even survive to this day without laying people off, and that might not be the best alternative for them. There was another method of relief, and that was the Refundable Tax Credit. Do you want to talk about that at all?
Sure. I don't have any guidance on that as far as inability to talk on that.
Okay. All right. Well, there is a tax credit that we would offer to businesses that again might have had to lay some people off or reduce hours, but it would be the ability to at the moment of reconciling this on the taxes for the current year, you would be able to defer the payroll taxes due for employees if those employees were retained for a percentage. It's sort of prorated based on the number of hours and the in comparison to the previous year's payroll. So it's a little bit more complicated, but it offers another way of providing relief to some companies that may not have been able to retain employees over the first couple of months of this before they received assistance. So that's out there as well. You're right, Bob. There wasn't a lot of guidance, just broad strokes on that. So we'll have to wait and see how the IRS gives us some guidance on that. Also, the Federal Reserve plays a major role here as well, and as does Treasury, with the ability to provide direct loans. There is an exchange stability fund that's also part of this bill that will allow the Fed and Treasury to look at the larger scale dynamics of this crisis and the effect of the financial impact on larger institutions. We did have we had a conference call with all of the CEOs of the major banks last week. So State Street, one of our local banks, Mr. O'Hanley was on the call, as well as the CEOs of 6 or 7 of the largest banks in the country. I do want to say that each of them was very complimentary to the fact that because of the Dodd-Frank Act and the higher levels of capitalization that were required by that act, that they were in very, very strong shape because of the capital requirements that were introduced by the bill. So that's one bright spot. But obviously, as this goes on, we'll have to keep a close eye on the larger systemic strains that are put on the financial industry. So I would like to just get to some questions here. I know members have specific need for specific industries, and might be best to have Jim manage some of those questions.
Great. Thank you, Congressman, and thank you, Bob. I would say that I've been on several calls now with Bob and the regional office of SBA, and you guys have been tremendous, and I know you'll continue to do so. For those listening, as process information and guidance comes out about the SBA loans and other dimensions of the COVID-3 package, we'll be putting them up on the Chamber website as that becomes available. So that's a resource for you as that information becomes available. Some of the questions, both the Congressman and Bob Nelson addressed in their comments. But one question, Bob, that you might be able to address, and Congressman weigh in, regards some of the personal guarantee and collateral requirements required in the SBA disaster loan program, with a specific focus on very small businesses under 50 employees, for example. Can you talk about personal guarantee and collateral requirements?
Sure. So on the economic injury disaster loan program, we don't require collateral for loans under 25,000. When we go over 25,000 up to 2 million, the SBA looks for collateral if it's available. The SBA likes real property, and we'll take best available lien. So we're not looking for a lender to subordinate to the SBA so that we can be in a first position, or so it's best available collateral at the time of application. As far as personal guarantees with the economic injury loan, we do require the personal guarantee of any 20% or more owners. If there is a business that doesn't have anyone who owns more than 20%, it does require the personal signature of someone from the business or from the private nonprofit. So under the Payroll Protection Plan loan program, it doesn't require personal guarantees. It is 100% guaranteed by the SBA. The loans are very different in the loan terms, and this is where we're going to need to do a side-by-side analysis in order to help businesses, figure out the best options for them given their situation. So we didn't talk about SBA's regular loan programs that much. So our regular guarantee program, which goes up to $5 million, and we provide a guarantee of 75 to 85% of the loan. There are businesses out there that are in need of traditional SBA backing, not disaster. So those programs are available. They're open. Our 504 program to buy, fixed assets, to buy a piece of owner-occupied real estate. Those programs are available. So as part of the stimulus program, what I've read is that there is a small business debt relief program where SBA would be covering the principal, interest, and fees for up to for 6 months on those SBA loans. So that's something else to keep in the back of your mind.
Great. Congressman, you mentioned the tremendous strain on all of our hospitals and healthcare providers responding to the virus and providing medical care, and also alluded to the economic strain that some of them are facing. It may be too early to answer some of these questions, but do you know how quickly the funds have been made available to our hospital community? Will be out there, and any sense of some of the criteria for that? For example, will it be based on Medicare revenue? How well? Any sense of that yet, or is that still in development?
Well, so what we put, a great question, Jim, and some of this is so new that I'm going to hazard a guess on some of this, but we approved $200 billion for hospital healthcare workers and health research. So that includes, expanding funding for getting that PPE that I talked about, and ventilators and all of that, but also for the underlying care as well, of the hours people are working. So, like I say, $100 billion of that $200 billion is targeted directly for the hospitals, and then it spreads out further. As I mentioned before, there's a $1.3 billion for the health centers. There's a lot going on there. In terms of getting the relief out to the hospitals, I would say, and this is just an approximation, but I would say 2 to 3 weeks before we, given the volume of work here, we've got some of these hospitals that are located in hot spots, like in New York and New Orleans, Washington State. So, and other parts of California as well, the Bay Area. I know those are priorities, and but also I know we have a number of very, very important hospitals here in the greater Boston area that will be looking for assistance as well. So I would say ballpark 2 to 3 weeks. That's when I would expect that, and that goes as well for direct relief. People are asking when these checks might come in. The one-time payments. I think you're talking 2 to 3 weeks on that as well.
Great.
So
Thank you.
Let me also, there are a bunch of other things that we did in the bill that are smaller numbers, but I know you've got a pretty diverse group at the Greater Boston Chamber of Commerce. You get some nonprofits, you got transit companies, you got, every shape and size. So just for completion or being comprehensive on this, we did provide $25 billion to transit agencies, which have seen a serious drop in revenues. Massachusetts will receive about $1 billion of that. So HUD, we've done emergency solution grants. That provides a couple of $2 billion for HUD emergency solutions grants to states that will be distributed by formula, basically on the number of people in HUD housing. I think Massachusetts, because of where we stand with our demographics, will receive about 60 million. I think that's how that works out. It's based on the number of units and the number of people in those units. We also provide a child care and development block grant, and I think Massachusetts will come up with about 45 million under that emergency appropriation. We provide, again, I talked about the 1.3 billion to community health centers. We haven't done the division on that in terms of Massachusetts, but we've got a very robust, league of community health centers that Jim Hunt runs, and so we will get our fair share of that money as well. I know there's been a very mild winter, but we did put money in LIHEAP as well for that. I think we've got, I think there's an extra $11 million for LIHEAP, even though we did have a fairly mild winter. There are still people that financially are in need. And then we did the Burn Justice Assistance Grant Program, which has been a great help in my district with our district attorneys and others. I know there's about 17 million that's put in those grants for Massachusetts. So those are some of the other various sort of catch-all provisions that we put in various areas to try to help everybody out.
Great, thank you. You actually anticipated a couple of questions that we're getting. We've got about 5 minutes left for the call. Congressman, you mentioned that there's likely a need for a phase 4 package in the works. We've heard Speaker Pelosi talk about that. Some guy named Tom Tenlin sent in a question.
Uh-oh. We should have. I thought we had him blocked.
He wants to express his gratitude, as do we all, for your leadership in these times. But, what's your thinking about another relief package? What might be the focus of that, or is it too early to talk about the details?
Well, obviously, we'll have to see how this tranche of money works, and we know there are gaps out there. We know there are. One of the things we were trying to do to hold harmless as many people as possible, we thought that because of the spike in unemployment, that it might be best to just have the federal government cover COBRA healthcare benefits for all unemployed workers. In other words, we we knew that it would be a tremendous jolt to regular insurers and healthcare facilities, healthcare plans across the board, Taft-Hartley plans. If these workers all come out of go into unemployment, and then they've got to scramble through this whole network of healthcare, health insurance to try to get their needs met. We thought it would be much cleaner on the House side to just say, okay, everybody will enjoy COBRA healthcare benefits, and the federal government will pick up the premiums. Because in many cases, COBRA is expensive. It's more expensive than you would think. So we thought that was a clean solution. That was not supported in the Senate, but I think if we revisit that, I think that will be one of the things that we reconsider in a fourth version. The other is so we have many companies have insurance out there, but because of the difficulty in doing a risk assessment on insuring businesses for an interruption in business, a lot of policies, I would say all of them or nearly all of them exclude this type of, the coronavirus impact on businesses, because it as you can see, it's so hard to assess. It's so hard to price that risk. So there is a nascent effort to try to address that problem. Some people just want insurance companies to pay for the coronavirus caused interruption in business. However, I think that a better solution would be sort of what we did after 9/11 with terrorist risk insurance. We tried to recalculate what the anticipated cost would be, and try to price that. And then we created a government provided backstop that yes, it created some exposure for insurance companies on the front end. But then when you get to something like this that is so difficult to assess the risk and the scope and to price it in a way that people can afford, you really do need the government to step in at some point. So I think we need to sit down with, Liberty Mutual and some of the really smart people in the insurance business and try to figure out what is that solution, rather than just saying, okay, we know you didn't cover this, but we want you to cover it anyway with private insurance resources. So I think that's going to be part of this next iteration that you see, and hopefully we'll come up with a thoughtful. We'll get all our insurers together, and we'll try to come up with a thoughtful approach that combines private insurance with a government backstop that might be able to put a competitive product on the market that won't be so expensive that our businesses gag in terms of paying for that protection, but yet provides adequate risk insurance at a reasonable price point for most businesses, especially smaller businesses, because they could be wiped out in an instant, as you know, under these circumstances. The other piece that, and I know we're running out of time, but the Postal Service. So as you probably know, during the 9/11 attacks, we had anthrax attacks immediately following. Yet the United States Postal Service employees, the letter carriers, the clerks, the mail handlers, continue to do their job every single day, like they do right now. So they're out there delivering medicines and medical equipment, and they're out there on the front lines doing a lot of courageous work on our behalf during this crisis, right? They're delivering mail to every single home and business in America 6 days a week during this crisis, and they continue to do so. And we have identified them as being the one agency that will be able to do a vote by mail system when we have to roll out our election in November for the presidency of the United States. So they've got major responsibilities here, and we provided zero for them in this bill, in this tranche. So we've got to revisit that and provide some assistance to the United States Postal Service so they can, cover their employees and give them some discretionary funds to address some of the hotspots that they're seeing and the way they do their business every single day. So those are some of the areas we're gonna look at, and I'm sure we have as we find the gaps, from your constituents, Jim, in the Greater Boston Chamber of Commerce. As we hear where the gaps are, we're going to have to try to re-engineer this on the fly in response to their concerns. So we need to have that dialogue between Congress and the business community, which I think your wonderful organization will provide a great resource to us on that end.
Well, thank you for those kind words, Congressman, and anticipating some questions around business and insurance. We are running out of time, but I do, several questions, and I always get these questions from my members. A quick comment, if you would. What more can the business community do? What's your call to action? And, what message do you want to leave for your constituents?
Well, I'll tell you, you know what the need is out there. I'll give you a perfect example. Last week, we were very, very low, and we continue to be low on PPE, personal protective equipment. And my friends over at Pipe Fitters Local 537, so they have a lot of welders over there and people who work in that industry that need respirators in their daily work routines, gloves as well, face shields, having been an iron worker for almost 20 years, respirators when you're welding, face shields as well if you're grinding. So they were nice enough to scoop up all of their, their surplus equipment, and I know they delivered a big portion of that down to Mannett Community Health Center down in Quincy, and the health center was just so appreciative of Local 537 Pipe Fitters for doing that, and the UA in general. That's been happening all over the country. A lot of the building trades are doing that. It's a wonderful, wonderful resource. The nurses really appreciate it. The docs, the healthcare workers who are on the front lines. We've had the building trades companies, the Contractors Association, the AGC, the BTEA, the Building Trades Employees Association, have reached out. Their businesses have contributed their surplus equipment to first responders. The police and fire, they're going into homes and trying to help people. EMS, so we've been able to, take some of these big businesses. I know that Home Depot did a great job. Lowe's, they had product on the shelves. They donated that as well. So, everybody's been wonderful. As I mentioned earlier, the distillers converted their operation over to, producing hand sanitizer with the alcohol. So, all of that counts. So, and again, I mentioned some of the housing people were able to offer vacant units. We are asking if there's any hotels out there in the areas of the major hospitals. If somebody has the hotel business is very low, right? So if you have floors that you could offer to some of these nurses that are working next door to you, over on Cambridge Street at the Mass General, or over at the Brigham, or the Deaconess, BI Deaconess, Tufts. If you've got vacant floors where you might be able to put up some of our healthcare workers so they don't have to go home, they can walk across the street rather than getting in cars and driving home after working 12 hours or 14-hour days. That would be great. I want to give a shout out to Local 26 hotel restaurant workers. So they are responsible in many cases for cleaning those hotel rooms that are now vacant, and they've offered to pitch in if we get some of these hotels to house our healthcare workers, they'll go in and clean the rooms in between shifts. When these guys and gals go back to work, they'll go in and disinfect and clean the rooms, so that we can keep these healthcare workers in a good place. So that's another, Brian Lang over at Local 26 offered that, and just warms my heart to hear that as well. So we're going through a rough patch right now in my district and in this country, and so I think it brings out the best in people in many instances. I think that what I'm seeing out there from VA hospitals to our local health centers and everywhere in between, people have been just so kind and thoughtful in terms of helping out their neighbors. It's like I say, it warms my heart to see it. Everybody coming together. We need more of it, and the longer this goes on, the more that our patience will be tried, right? But you think about what this country's all about. You try to tap into our better angels and remember that there are people out there that are losing loved ones, right? They're unfortunately during this past few weeks, I'm someone where I represent 22 towns and 3 cities, and some dear friends have passed. Dear friends of mine have passed. And we're unable to provide comfort and consolation to those families that have lost loved ones. And, it's just been so tragic that we have not been able to go to wakes and funerals and be with our friends and neighbors during the most difficult times in their lives. So, please try to remember that there are families going through that. It might make your own inconvenience seem a little bit less serious, and might cause you just think about those people, and maybe that will bring out a greater feeling of commitment to your fellow neighbor. I don't know. We're also, they've stopped doing masses, so I've got the largest Irish Catholic population in the United States in my district, and so I've seen Father Casey. He's online now. He's live streams his masses, so his constituents will be able to watch that. It's much different than getting together in a church and receiving the Holy Eucharist and all that. That comes with the joy of celebrating Mass, but it's one of those accommodations that thankfully we're able to do with the help of Local 11. They went down and provided lighting at Gate of Heaven so that the masses could be produced, live streamed, and it looks beautiful. It's well lit. But that was JCal Pro, which was one of our local lighting companies owned by Jimmy Calman, a local South Boston guy who brought his company in there and provided that service. So there are all kinds of great, examples of people pitching in and trying to doing the right thing. And I think, like I say, I think this crisis, like so many others, has brought out the best in the people in our area and the American people. And I just think that in terms of us, of we in government, we've got to live up to those highest standards as well.
Well, Congressman, I know that you're supposed to get on another call and go back to your work with your colleagues in Congress. Thank you for your leadership, for your time today to share your insights with us, and most of all, for your leadership in this moment of crisis and bringing us all together, business, labor, nonprofits, government, everybody, and for that closing uplifting message. So thank you to Congressman Lynch. Thank you to Bob Nelson for spending time with us. Before I close, I do want to remind everyone on the call to visit our website, bostonchamber.com, for updates on some of the information you heard on this call. We do have a couple of more programs coming up this week that may be of interest. Tomorrow at 10:30, Secretary of Labor and Workforce Development for the Commonwealth, Rosalind Acosta, will join us for a discussion on the labor laws and changes during COVID-19. Two partners from Goodwin's Law Employment Practice will also be with us on that call. And on Wednesday, Congressman Lynch mentioned that the Federal Reserve has a very big role in the distribution of funds in their region. On Wednesday at 2 p.m., we'll hear from Eric Rosengren, President and CEO of the Federal Reserve Bank of Boston. So take a look at our website for information about how to register for those calls. Once again, thank you to Congressman Lynch and to Bob Nelson, and thank you all for joining in on this call. I'll be signing off now. Stay safe, stay healthy. Bye all.
Thank you, everyone.
Thank you. Thank you.